I have the honor of sharing the stage this afternoon with the Deputy Commissioner and State Medicaid Director for the Alaska Department of Health, Emily Ricci. And in this role, she helps guide Medicaid redeterminations and navigates the changes to federal funding and eligibility structures. Before stepping into this role, Ms. Ricci served as the Chief Health Administrator for the Division of Retirement and Benefits, where she oversaw Alaska's state employee and retiree health plans. She also has experience as a healthcare consultant and served as healthcare policy advisor to the Office of the Governor back in 2014. Deputy Commissioner Ricci holds an MPH from the University of Alaska, Anchorage. And I am also sharing the stage with Jared Kosin. Am I pronouncing your name right? Great. Who is the President and Chief Executive Officer of the Alaska Healthcare and Hospital Association. In this role, he leads advocacy efforts and coordination across hospitals, nursing homes, and healthcare providers statewide. Mr. Kosin assumed this role after serving as Associate Administrator as well as Business Development Director at Matsu Regional Medical Center. He also served as Executive Director of the Office of Rate Review at the Alaska Department of Health and Social Services. Mr. Kosin holds a JD from Michigan State University College of Law and an MBA from the University of New Hampshire and a bachelor's in English from the University of New Hampshire. So please welcome our speakers, our panel. And Deputy Commissioner, if you don't mind, I'm going to start with you and ask if you could please share with us the department's perspective on the arc of the department in the last couple of years with the pandemic and the change in administration and how that has shaped Medicaid and what you think the future might look like.
Hi, everyone. Good afternoon. Well, it's nice to see so many familiar faces here today. And as I was thinking about the last several years and where we're at today and reflecting on, I think how the department has changed just since I joined, not even quite 3 years ago. One of the aspects I was reflecting on is, one, how long I've known Jared, right? But how many people in the room I know and I'm familiar with and I've worked with in different roles over the last several years. And I just want to think a little bit about the strengths that we have as a state. And one of the strengths that I think we have is that we all know each other and we all work together generally pretty well when we want to. So I guess hi to the many people I know out there and have worked with and those who have supported me over the last several years and throughout my career. Well, I came into the department about 3 years ago from the state of Alaska employee and retiree health insurance plans. And I joined the department as it was coming out of responding to the pandemic, facing a cybersecurity attack, and undergoing kind of the general effects of that on our department, our personnel, and our systems. And I think what we experienced at the department is something that everyone experienced in different ways, but particularly in the healthcare field following the pandemic, right? We had to make dramatic changes to our delivery system. There were the changes took a toll on our personnel, on our finances, on our staffing models. We saw a wave of retirements following kind of the end of the pandemic when things started to stabilize because people were tired, they were burnt out. I know hospitals and other healthcare delivery systems were dealing with the same thing. But in the department, we found ourselves facing the loss of decades of knowledge that had been with the department for a long period of time. That is always hard to fill, but it also provides opportunities for new voices and new perspectives to come in and learn. But there's a steep learning curve that we have to build up in a number of different areas within the department. So as we kind of come out of the pandemic and we came out of the kind of the cybersecurity attack and everything that followed, there was this moment of almost like stabilization, figuring out, okay, where are we? How do things feel? What is our foundation like? And at the same time, the department split from kind of what they would refer to as a mega agency into the Department of Health and the Department of Family and Community Services. And I know that there was a lot of discussion about the benefits and the potential risks of that split. But I think from our perspective now, over 3 years in, it's been a really positive step. It has allowed both departments, I think, to have kind of the time and the space from a leadership perspective to really dig in and spend time with our divisions and the issues we face in a way that you just can't when you have the size of the department that we did in the past. So coming out, I think we had a chance to stabilize. We had a lot of staff turnover, and we really needed to step back and look internally at what was strong, what was weak, and where we needed to focus on kind of creating our foundations. And then we needed to also look externally to understand how has the healthcare system changed, how has our patients' needs changed, how have Alaska's needs changed, and what does the path look like going forward? Because it looks really different than it did in 2019 or 2018. So today, 3 years in, you know, I think a few years ago I joked, like sometimes with the divisions, you would kind of look at them and be like, they look pretty strong, and then you tap on it and you're like, oh, it's really brittle, it's really hollow underneath. Like the division is keeping these processes and these systems going through like sheer willpower from very dedicated employees, not because they necessarily have like the tools, the time, or the resources that they need to do a good job. It's because they're motivated to like keep it going and to make sure that the services they're providing are there. I think we're moving past that as a department, but it hasn't been without challenges, and there's still challenges as we move forward. Now we just got through the redetermination process. When I started, it was called a historic effort by Medicaid programs to basically review within a year every single eligibility of every Medicaid enrolled Alaskans. These had been suspended for a 3-year period in response to the pandemic. We completed that. Alaska took the time and the space it needed to ensure that the systems and the people supporting that could work through the redeterminations, and we did complete that. It took us about 2 years to do that, but we completed that in April. And now we're facing a new set of challenges in the Medicaid program. We're facing some of the largest Medicaid changes that have occurred since the Affordable Care Act. And again, we're coming together. We're talking with community partners. I know I've met with many of you over the last several months to talk about what the changes in the legislation mean and how can we come together to address those. So as we think about where we go in the future, I think about kind of building off of the past. We continue to see some of the same operational and institutional challenges within our department that we saw at the end of the pandemic, but they are getting better. I think we have a path forward. We have made some progress. Operationally, we're working with systems that are very old. Some of our oldest went live in 1983, and we are grateful again for the legislature and their support in helping fund the work that we need to move off of those systems. Some of our other systems are maybe not quite as old. Maybe they're only 12 years old or they're 13 years old, but they're systems that are core to how the Medicaid program functions. Those systems are reliant on people. They're reliant on people to push the button, to do the thing, to move something forward. And we're in a space right now where we don't have people the same way that we did 14 years ago. And we're probably not going to have that in the future. So we have these challenges that we're working to operationally, that we're working to stabilize and move through, but we also have these opportunities. So as we think about the systems that are challenging, that rely on people to do the things, we also have the emergence of AI, right? How can we begin to leverage AI as we update our systems so that we can be more effective? So it's both a challenge and an opportunity. From a policy perspective, you know, we hear the needs around the state for increasing access to behavioral health services. When I think about the future, I think about our aging population. We have a lot of communities with our senior population who is growing, and I'm concerned that we don't have the resources we need to support them in their communities. When I think about who's going to be in my seat 8 years from now or 10 years from now, I think that is going to be one of the largest challenges that they face, is how to care for and support our seniors in their communities. And in Alaska, we have made a choice that we want to keep people in their communities for as long as possible, because that is the best place for them to be. So how can we start thinking now about what we need to build out so that we meet those needs? I think about the needs of individuals who have very, very complex behavioral and physical needs in our communities. I think it is one of the challenges that we've become very aware of over the last few years, but that is an area that we need to focus on and build out. And then finally, I think about primary care. I think we all know that the basis of healthcare in Alaska, or any system, really, we want it to be primary care, to be the foundation for where someone goes when they need advice. And we know that we don't have sufficient access to primary care, and we also know that for our seniors, that access is becoming even more challenging. So as I think about like where we're at today, we have these kind of operational and foundational challenges that we are working through. We have opportunities through AI. When I think about the policy challenges, I think about the needs that we have today and those we will see in the future. But again, I see some opportunities. I see challenges with some of the new changes to Medicaid, but I see opportunities with things like the Rural Healthcare Transformation Fund. And ultimately, I think our biggest opportunity within the state is that we all know each other and that we can all work together really well. And I'm born and raised Alaskan. Like, when we want to do something and we want to make a change, we can do it. I think it's just a matter of us coming together and deciding it's the time and there's a path forward to make that change.
Thank you. And Jared, what would you say has changed for your organization and its members, and what does the future hold for you?
I guess before I answer your question, I definitely want to tee up something. Why didn't she have a timer and I have a timer? What is that?
And that time's not
It feels
accurate.
very
You don't
offensive.
have
I
that much
talked
time.
too long.
I have 49 minutes to answer this question, so I'm going to take all of my time. The first thing I just want to say is going on what Emily, as she was kind of talking about this, I think it's important to acknowledge what a thankless job, our Department of Health, our state employees have in trying to keep these systems going. Because I'd say 9 out of 10 times people call the department, it's with a problem and it's a complaint. And that's pretty hard, on your psyche. And I just think about all the people who have chosen to serve. You, Emily, I know the commissioners here. I just saw Dr. Joe McLaughlin in epidemiology, Tricia Franklin, public health, Kate from public health. It's like looking at the challenges ahead, and I'm sure we're going to talk about them. I just think it's important that we all recognize how important these individuals are, because the system cannot exist without them, and they are enduring, I would say in many ways, a lot harder things than we are. So, that was awesome. That was not planned. How's my organization changed? In many ways, it would be boring to tell you. I think we're all evolving in the same way. Right now there's a lot of turnover at the executive level, a lot of turnover at the staff level. But I think when I look at how our organization is changing in the future, I just think about looking back in time and the journey through COVID, and then the disruption after, and kind of the fall from grace of kind of healthcare hero to many respects villain, and then what kind of lays in front of us in terms of disruption, a complete lack of predictability, and problematic policy. So I think we're still very much kind of evolving our identity, and honestly, we've been in constant change for the last 5 years.
Great. You have 47 minutes left. All right, great. I also wanted to point out that we, in this morning's plenary, we got some cards filled out with questions and thoughts that we plan to address throughout the day, not just here and now, but throughout the day at the different sessions. But one of them was asking for commitment from state representatives or state agency representatives to be sincere, and I think we have that commitment for people to be sincere in what they're saying, and so we will ask for that throughout the day. One of the questions was related to bridging the gap between providers and state agencies. So I'm curious about your thoughts on how to bridge that gap between providers and state agencies from both of you. We'll start with you, Deputy Commissioner.
I feel like that is, I'm so glad somebody asked that question, because I think that is almost the core of what makes an effort or a focus area successful or not, right? I mean, I think we're filled, I think most people don't get into this industry, whether you're working in state government on a Medicaid program, or whether you're working as a physician or a provider serving the needs of Alaskans. Like, I don't think you do it because it is something that you are motivated by to help other people, right? Or to like meaningfully contribute to the system that you're in. And so I think when I see kind of two voices coming together but not connecting, maybe talking past each other or talking parallel, it's not because they don't share the same goals, typically. They share the same goals. They typically share like many of the same values in terms of we want to provide good care, we need to do it a sustainable way, and we don't want it to be too complicated, right? Like we want to focus on the patient, we don't want to focus on the paperwork, and we need to be able to run a sustainable business. We also need a sustainable budget, right? Like those are shared goals. Those are core values that I think we all share. I think sometimes what I see happening is that people are so focused on their kind of slice of the pie or their world, and they're trying to communicate, right? Like the limitations that they see or that they experience in their world, that they're not able to actually listen to what the other voice or the other person is trying to say. And they can't always appreciate the limitations and the nuances of the other person's world. And I say that on both sides. You know, sometimes the best policies and the best systems look really good on paper, and then when you try to execute them, they fail miserably, right? Because the people who are designing them don't have the hands-on experience to actually see what happens. On the other side, you have people in a system who are trying to provide care, who are working really hard to meet that patient's need in an incredibly complex system, and they want to, you know, they do not understand, and for a very valid reason, why it has to be so complicated. Why do I have to provide this information? Why don't you trust me? I have gone to school for a very long time period. I have been through all of this training. Why is there another check on what I have to do? And that is a valid concern. I think what sometimes they don't see is like the magnitude of regulations coming from the federal side or the audits, or not that I want to put the legislators on the spot, but like sitting in front of a legislative committee explaining your audit findings is really uncomfortable and terrifies a lot of our staff, right? So sometimes we have these kind of disconnects in terms of our worlds and what motivates us, and it can be really hard to bridge that. But what I found is like, it's actually getting people like me out of the room, right? And it's getting the people who are actually working, like the technical people who are actually doing the things on both sides into the same room to talk. And that is when I see meaningful progress made, because it's like the little things that we don't get right on the state side that can really be difficult for providers. And too often I've been in meetings where like I'm talking and the head of an organization is talking and it gets really heated and we're kind of talking past each other, and neither one of us actually really knows what we're talking about, to be honest. We're just repeating what somebody has told us, and we're trying to defend our position. And when we get out of it and we let the people who are doing the work talk in a safe space, they fix it. So, I don't know, it's just one idea that we have, like, how can we get the people who are doing it to connect and like get people like me out of the way?
There's nothing really to add. I think that was a perfect answer. I mean, it's true too. So, I mean, you nailed it. And I think that's why we really are uniquely suited here. And I wasn't planning on talking about the pandemic. By the way, we do not know the questions That was one thing we asked for in our prep session, was keep the questions a surprise so that we can have a real conversation. And here I am, question 2, talking about the pandemic, but the way we united and gave each other space and grace, and then would be able to come back together, I think shows how close and how we all know each other. I mean, I know I say things that definitely agitate the department sometimes, and yet we're still here working together. And I think that's a testament to trust and really the genuine commitment to pursuing the common good. We all have, I think, the right intentions. Sometimes we disagree on kind of what they should be or where they should be, but I think as long as we give each other space to kind of express ourselves, but then come back together and get back to work. I mean, we've proven time and time again, at least, Emily and I, Lynn Kelman Cruz and I were talking about an issue today. That's where you have success, is building that trust.
Thank you for that. And we got a late start, and I do have questions for you, but I don't want to take away from time for the audience to ask questions. And since we got a late start, I'm going to pivot to the audience questions now. And I'm 98% blind. Looking out at you, I can't see because of the lights. I can't really see you at all. I think we still have the mic stands. Is that true? Yes. Yeah. Okay. Great. If you have questions for our panelists, please come to the mic stands and shout them out.
I would say make them hard questions. Have some courage here.
Lobby some hard questions at us. Great.
I'll be brave. DC Ritchie, you spoke about the challenges of having people to actually run these programs. What is the biggest challenge to filling those positions?
No, that's a great question, and I would say it depends. There's a couple of, think about why any of us take a job, right? I know for me, there's always compensation, right? That's a key element, but that's not the only element at all. There's a culture element, right? That's really important to me. There's a culture that I want to work in. I say externally, I can stand up and I can do the pressure externally all day. It's internally, when there's internal conflict, for me that's really hard. So for me that's a personal choice, right? So I think culture is really important. And then the third one is kind of motivation. What are the goals of the organization? I'm going to spend we'll say it's 8 hours, we'll pretend, right? A day of my, in my life working towards something. Is it something that I care about? For me, that's important. Everybody has different motivations. And so I think you have to care for all three of those. One of the biggest challenges that we had coming when Commissioner Hedberg and I came in is we had very high vacancy rates in a number of our divisions. I know at one point healthcare services had a 38 or a 30% vacancy rate sustained for a period of time. You have 1 in 3 employees out. Not only is it hard to, perform your basic services, but it is also hard to recruit because word gets out. State employees talk. They know where kind of the good divisions are and where the hard ones are. And if your staff is overworked consistently because you have a really high vacancy rate, word gets out and it can be really hard to recruit more staff. And then there's a cultural element of it too, right? Every division has a different culture. I've worked in a few. The culture and the leadership can really, I think, impact that. So I highlighted healthcare services because their vacancy rate, I think, is in the low single digits at this point. So within the last 18 months, they've managed to turn that around, and they're fully staffed. They have been recruiting some of the high-value employees from other divisions, which is always a good sign. Now we'd like them to recruit from other departments and outside of the state of Alaska, please. Let's bring in new voices. But I think all three of those things are really important to consider. And I think when any one of those is off, you start to run into challenges. I think the good news, though, is you can actually fix it pretty quickly if you have the right combination of ingredients, right?
So I'm going to take your question and I'll answer it how I want to answer it. I think if you look ahead down the road in healthcare, not necessarily the people in this room, but I guess there has been a great disservice done to healthcare that is definitely going to keep people from wanting a job in it. And to me, it comes in the form of burnout. And I'll be honest right now, I'm burned out. I'm burned out from other stuff going on in my life, but I'm burned out. And one thing that really kind of crushes me is what's going on with the polarization in just the modern political system. But to take one step forward, what's happening to public health, vaccines in particular, and the attack or question of credibility of science is taking us as a society to the dark ages. And that's not a controversial take. I thought about this ahead of time coming into this. I mean, last week you have a state, Florida, that is actively trying to repeal all of their mandates, vaccine mandates for children. I mean, I don't know if Joe McLaughlin's in the room. I've always, Joe, what'd you guys say? I had a man crush on him during COVID. The guy's like the smartest dude in the world, and I got to watch him do his work during COVID. But I'm like, ask him what he thinks of that. I mean, the guy has dedicated his life to science, and it is systematically being undone, and it is unquestionably setting us back. And on top of that, not only this issue but others, there's this level of anger and frustration and divisiveness that I will tell you, if you look at all the industries going, if I'm starting to enter the workforce, on paper we have a lot of jobs and a lot of quality jobs. I don't know if it's worth the baggage. And that's a problem.
Thank you for that honesty. We have another question, I think.
Yes.
Yeah, there you are.
Hi, Jared.
Shannon's like the
Hi,
worst
guys.
person in the room.
I was just going to say there's chicken.
Yeah.
Okay, we have
No,
chicken now,
we're very
everybody.
good friends.
There's chicken. Yes, Jared and we're frenemies. Sometimes we're on the same side of legislation, sometimes we're on the opposite. One thing, just because it's a program that he is a part of, which I think is huge, and it's making advances in nursing, is two things. One is the Nursing Workforce Development Program, which is very new to our state. It's something that I think will, as a nurse myself, will make a huge impact, both on our future nurses, our current nurses, our nursing students. So I want to give him a shout out for that. Take it, because we'll see each other in January in Ledge. But I think the other thing too is we don't talk enough about is we do have these relationships. I'm part of the Alaska Nurse Association. Sometimes, like I said, we're on different sides of the field, but I think we're all here for the same goal. And one of the programs that I like to just throw out there is a program that AHA has started, which is getting people excited about healthcare, not just nursing, but X-ray to IT and healthcare to electronic health records, God help us all. But I think it's something to make note of. And my question to you is, where do you see it going in the future? Like, what are you going to expand upon?
Well, God, I wish you had told me you were going to say those nice things before going up to the microphone. I wouldn't have taken that shot at you. Obviously, Shannon and I are good friends, and yes, she's a force. And when we disagree on issues, we obviously do so in a very constructive way. and our friendship's very much intact. Find your fit, is that what you're, yeah, so we do. We have a really kind of ingenious campaign that we developed with workforce funds from the state of Alaska to build this platform called Find Your Fit. And what's cool about it is I don't go on social media very often, and that doesn't interest me very much. But obviously, the incoming workforce does. And so it's the idea of meeting people where they are, and it is a platform designed to let people take quizzes. Where would you fit into healthcare? Answer these fun questions. And it then kind of puts you into these might be the type of career fields you're looking for. And then it goes beyond that and starts to kind of pair you up with resources and steps you'd need to take to get there, and other connection points. We have videos from actual Alaskan facilities, actual nurses like Shannon, to kind of promote what it means to be a nurse up in our state and in any other positions. Rad tech, sterile processing, you name it. So it's Find Your Fit. If you Google that, you'll find it. And it's a really good thing. And so your question is, how do we plan to expand it? You know, I think programs like this, I'm hopeful find a chance to evolve with the potential funding that's coming in with the Rural Health Transformation Program. With the OBBBA, I'll call it OBA, I don't think it's good healthcare policy. I don't. I think it results in loss of coverage. I think that is a backwards way to solve healthcare. But I do think there's a silver lining in there. And I do think I and we owe a thank you to our senators, Senator Sullivan, Senator Murkowski, for pulling in what appears to be hundreds of millions of dollars coming into our state. And while the other parts of the policy are really frustrating and hard to deal with and plan for, and I think they're going to be extremely challenging with the outcomes, we are given an opportunity to reinvent ourselves. And it's something we cannot waste. And so I think it's any projects that we think will expand the workforce, expand this concept of transforming, and I think Find Your Fit, might have a place with that funding down the road.
Just kind of want to expand on that last part, right? When we think about the future, I know technically this session is the future of Medicaid, but I think really it's like, what does the future of healthcare delivery and payment system in Alaska look like? And I've been involved in this since, for the last 13 years, which is like peanuts compared to some of the people in this room. But it's enough to see a couple of cycles. And one of the things that I always think about is sometimes the biggest challenges are also the biggest opportunities. And I think we are in that space right now. We are absolutely going to have some challenges related to how we operationalize and the outcomes of the reconciliation bill. You can call it OB3, but I'm just going to call it the reconciliation bill. Oh, OB3, yeah. I'd like to say we started that and other states picked it up. Yeah, we're going to go with the reconciliation bill. And it's happening at a time where we have a lot of focus, for very good and important reasons, on our Division of Public Assistance eligibility systems. So I think the question that we have right now is, how can we use either some of the funding or some of the focus on the Medicaid eligibility side to help accelerate the work that is already happening in our Division of Public Assistance. And a lot of that work comes down to getting some of these new technology systems up and running as fast as possible. And we are on schedule, we are on target, and we have the funds. I think now what we're trying to look at is, with some of the changes that will be occurring over the next 2 to 3 years, is there a way where we can try to accelerate some of that, and how can we leverage technologies to facilitate the process and make it easier ultimately for Alaskans to engage in the system. That is the long-term solution, is we need to have systems that are easy for Alaskans to use, because that supports our staff and it makes the rest of the system work well. We have all the ingredients. I think right now it's a matter of timing. But so that in my mind is a challenge, right? And it's a big one, and it's really important because those individuals are using the healthcare system, and their needs will be met either efficiently or inefficiently through the healthcare system, and a lot of that is going to come down to whether or not they have access to the Medicaid coverage that they are entitled to, and or they can gain access to that. So I don't want to underestimate that challenge, but the flip side of that is we have a huge opportunity at the same time. And that opportunity is through a combination of the funds available through the Rural Healthcare Transformation Fund, and Commissioner Hedberg is going to talk about this later on, but it could be significant money for Alaska. I think combined with the fiscal challenges that Alaska is facing, but the rest of the nation is facing as well. I read yesterday that private health insurers are anticipating, and I can't remember if it was private health insurers or employers, were anticipating the largest increase in health insurance costs that they've seen in the last 15 years, right? That is happening at a time where states across the country, their budgets are stretched. There's also been some financing changes to the Medicaid program. Some of those don't impact Alaska. We are actually the only state that does not have a provider tax and does not have state-directed payments, which are funding mechanisms that were reduced through the reconciliation bill. So Alaska is not impacted in that way, right? Our focus really needs to be on eligibility when it comes to the reconciliation bill. But nationwide, you are seeing this increase in healthcare costs. You're seeing providers who are stretched to the edge in some places. You're seeing challenges in rural parts of America with keeping hospitals open, right? And you're seeing state budgets that are also facing challenges, particularly after a lot of the pandemic era funding stopped. So we're walking into this really, I think, challenging time for healthcare, not just in Alaska, but for the US. Alaska, our challenges are unique, but they're not always that unique. They tend to be more extreme than what you see in other states, or a little bit different, right? So we're not situated the same way other states are, but we have our own set of challenges that are going to be pretty, big ones that we have to face. I think the question that I sit back and grapple with is like, we've had these conversations over the last 13 years I've been involved where we're saying like prices are too high, we can't sustain it, providers are struggling, and Alaskans aren't getting the outcomes that they need in the healthcare system. Like what we're doing isn't working. We know that we need to make changes. I think my question is now going to be the time where we have enough, there's enough of a catalyst between the changes that are happening at the federal level and the opportunities with the Rural Healthcare Transformation Fund for us to begin to make some of those changes. And I think it actually goes back to a lot of the people who are in this room today, right? Like we all know each other. Systems are made up of people. That is maybe the biggest lesson I learned when I walked into this job. Systems are made up of people. And they really reflect how well people either work together towards a common goal or how much they fracture apart. And so I think that if we decided that we had a common goal and that now is the time and we want to leverage the opportunities that we have in front of us to meet the challenges that are there and are not going to go away, I think we can do that. And I am always Pollyanna-ish, that's probably why I do these jobs, but like, I'm really hoping that this is that time and that we can leverage these funds to kind of walk across the shaky bridge to the healthcare system that we want to see. I don't know that we need more studies. I think we all kind of intuitively in this room have a sense of where the challenges are, right? And what some of the solutions are. I think now we need to start building out plans.
Because no panels ever do this, but just to like fight with you a tiny bit, I do, because I appreciate what Emily's saying, and she's right. My only complaint, because we can complain, is I mean, there's no doubt forced change is happening. And maybe I'll be wrong about all of this. Disruption, leads to change. I get it all. I still am really struggle with the forced change we're going to be put into. Because, as I said, I just think the way we're going about to change healthcare, anytime I think anyone loses coverage, especially a vulnerable population, I just don't think it's a good outcome. And I think we're going to see a lot of that. And I think we're going to see providers struggle with the implementation of the OB3 requirements. And I think it's going to be really challenging. And I just need to air that on behalf of providers because it's frustrating. Because, and I'm gonna steal this from someone who said this morning. The ethos right now against the healthcare system is burn it down. And I just don't think that is the most constructive way to go about affecting change. But with that said, you know, the fire has been lit. The circumstances are what they are, and it really is about looking ahead, and that's where I really appreciate your optimism.
No, I mean, I can understand all of that, and I can see that as well. And I don't want to say that things are going to be easy or that we will get it right the first time, because we won't. I can also tell, I mean, I will also be very candid. Like, the Department of Health, we're not going to be able to do this successfully by ourselves. We are going to have to rely with community partners, and I know Jared and AHA has stepped up, some others in the room have, right? But this is not something that we're going to be able to do without a lot of strong support. And I'm gonna call out Shelley over there from Fairbanks. Hi, Shelley. Because, you know, there's this moment when I started in this job where Shelley stood up in Fairbanks and I think really shifted a conversation regionally about how Fairbanks could come together to help, I think, outline the priorities and the needs in their region versus kind of the state coming in and do that, where we are a partner to support and a key role in the infrastructure, but we may not be, and we are probably not going to be the best ones to articulate for Fairbanks what their needs are and the best way to meet those needs. And so I think about that a lot when I think about a model of leadership to look towards and how we partner together to meet the challenges that we have in the future.
So Emily, I like what you said, and I want to make a comment on it. You said, you know, if not now, when, Emily? After Bartlett goes broke, after Fairbanks goes broke, after Kenai goes broke, if not now, when, right? So we do have to come together and we do have to make this work. And we have an opportunity with this money to do something great for our state, but if we don't come together as a state, we will waste this money. So I guess it's my call to everybody in this room, like, we need to change healthcare and we need to change it now. Now, maybe the Providence and Alaska regionals won't go broke, but the rest of us will. And so we need your help. And what's the plan? Let's get on board.
Thank you for that. Gosh, this is a great conversation, and I hate to.
Pretty sure we have 18 minutes and 46 seconds left. So.
I know. I wish I didn't have to call it to a close. It's a great conversation. We do have a next session starting in 5 minutes. But what I would encourage you guys to do is please find our panelists. I am making an assumption that you guys are open to people coming and asking questions if they still have them, and continue.
I am not. I am not.
Leave me alone.
I am.
Yeah. And thank you so much for taking hard questions and for your sincerity and your honesty and your answers. And thank you, audience members, for asking the questions and sharing your thoughts. And please continue to do so and continue to have these conversations. And we'll have you go to your next session. Thank you.